People often conflate public health and healthcare, two very distinct and important disciplines that critically impact the well-being of people and communities. But when it comes to public health, it involves a vast system of state and local agencies and nonprofit organizations to ensure that our food and water supplies are safe, that the places where we live, work, and our children go to school meet safety standards, and to provide specialized services to help people with various needs. Many of those services faced unprecedented challenges during the pandemic, but there were also many lessons learned. I'm Wyatt Cash with Scoop News Group, and here to talk about how public health officials can build on and sustain those lessons are Belinda, Minta, and Zakir Hussain, who are both principals at EY. Belinda and Zakir, thank you so much for joining us.
Thank you for having us.
Belinda, let's start with you. When we talk about public health in a post-pandemic world, even though we're not quite there yet, can you give us a picture of how public health leaders are leveraging technology to improve constituent services?
Sure, and thanks again, Wyatt. As you think about the array of services that are provided by public health agencies, it's expansive, comprehensive, and touches people in the places where they live, work, play, worship. And its reach spans across our lifespan from birth through adulthood and into death. And as we think about improving services, public health is leveraging technology to engage people differently and in ways that are more person-centered. We also know that leaders are going to leverage technology to reach people and provide services in places that are not your traditional settings. So let's explore telehealth, for example. In the COVID-19 response, and especially in the midst of surges, our systems were overwhelmed and focused on urgent and emergency care and services to those in critical need, while balancing that with the need to reduce exposures and transmissions. Consequently, we saw a shift in greater reliance on an appreciation for and comfort with telehealth or telemedicine. So via mobile devices, tablets, or personal computers, really a personal preference. This has expanded and will continue to expand the capacity to provide services such as chronic and infectious diseases management, counseling, early intervention visits for children, substance use disorder treatment, while improving access and availability to care, especially among vulnerable and underserved populations. Also, I just want to share another example just to highlight the way the COVID response required leaders to engage people in ways that matched the scale of the pandemic. Technology enabled leaders and public agencies to conduct case investigations and contact tracing at a pace required to keep up with both the speed of the transmission as well as the spread of the virus that causes COVID-19. Leveraging mobile device technology and apps to notify people of potential exposure, and not only notification, but enabling them to report symptoms, providing them with isolation and quarantine guidance, as well as sharing resources on social supports and services that may be available and enhances surveillance capacities, which is a core public health function. These are just two examples, but highlight ways that we will continue to see technology used to improve services, programs, and the interventions that are developed.
Well, Zakir, can you describe maybe some of the key challenges that were unique to public agencies that are focused on health services that you and your team observed as they tried to deliver public health services to the public during the pandemic?
Sure, yes, thanks, Wyatt. And I would say the key challenges that the agencies faced had some recurring themes that we noted across multiple states and agencies, including, I would say, a lack of standardization and centralization across data, tools, and processes, which resulted in many redundancies and inefficiencies. Second, which created many bottlenecks, would be the use of manual processes, where there was clear opportunity for automation. So, and as you kind of go a little deeper on that, like one for faster data entry and data capture, and secondly, for accuracy and completeness and timeliness. Manual data entry, data cleansing, and data linking efforts, some of which were due to lack of integration and interoperability between the systems. It created limitations in the agency's ability to make data-driven decisions. And then also manual data entry processes led to incomplete data and data integrity issues. So, this also resulted in creating workforce capacity issues for agencies. And I know that, our focus today is public health agencies, but even for providers and pharmacies, they ran into similar issues because of not having automated processes in place for entering vaccine administration information. And it also led to inability to do it fast enough for reporting purposes when the providers were administering hundreds of thousands of vaccines per day. So, and finally, I would say the siloed systems, which lacked interoperability, created significant difficulties and delays in data sharing, data analysis, and accurate reporting.
Well, and Belinda, as we kind of take a more forward-looking view, can you elaborate maybe on how public health organizations are now taking a new or more innovative approach to delivering public health service based on some of the things that they've learned?
Right. I touched on the increased use of telehealth and its role in delivering services in non-traditional ways, for example, and that's going to continue to expand. But we also saw greater emphasis and application of data analytics to help inform decisions about where, how, when, and to whom services were delivered. And Zakir mentioned data. The public health collects, analyzes, uses, reports on volumes of data. It's a wealth of information that's available through the functions, through the services that public health provides. And these data, unfortunately, often sit in disparate and legacy systems. And what we're seeing is that organizations are beginning to modernize their systems, and more importantly, or equally importantly, knit data together to be more predictive in order to strengthen early warning systems, get ahead of emerging events or outbreaks, for example. And to revisit something I mentioned previously, modernizing these systems and leveraging data supports a better understanding of the whole person, right? Focused on that whole person, their physical as well as their mental health, and also the services that the individual receives, not just siloed across different programmatic areas. And as we think about the ability to better coordinate and tailor those services, reduce duplication and redundancy of efforts, and take an approach that really maximizes the resources that are provided and available. Also, if I can provide just another example to highlight innovation that's underway, is around digitizing vaccine records or immunization records, for example. By entering some personal information, many people now have access to digital copies of their COVID-19 records, and in some states, other immunization records. And this is a move from a fairly archaic process, right, that has been in place for many decades now. And it's really a move from filling out a form. You download the form online, or you go into an office, you fill out the form, you submit it online, you drop it in the office, you drop it in the mail, then you wait a few weeks to get a physical copy. Now with the digitization of these records, people can get it in real time in a matter of minutes once there's a completion of that form and then some validation and verification of their identity. So public health is definitely exploring and implementing new and innovative ways and approaches to serving people, and communities in places that are particularly convenient for them.
Fantastic. And then Zakir, lastly, what can state and local public health leaders really do to build on and sustain some of these lessons and, really continue to engage their constituents, while maintaining the momentum of digital transformation?
So, I think, if you think about the key challenges that we talked about, those challenges actually really helped shed some light on the fundamental issues, including the need for funding, for building out some foundational capabilities in public health instead of, the time limited and restricted work that's being done through supplemental funding. The need for workforce enablement, especially in a remote working environment, some of, based on some of the things that Belinda just talked about and how we combine it effectively with automation capabilities, and then a need for standardization through utilization of modern technology, including, we talked about interoperability to eliminate data silos and through implementing proper data management and data quality controls. So the silver lining in all of this was that the pandemic created this necessity and paved the way for implementing major changes in processes and adopting the use of cloud data platforms. So the momentum has created a unique opportunity for agencies to leverage modern technology for faster data access, for eliminating data silos, for utilizing a combination of internally available data as well as mass amounts of helpful and useful data that's available externally, and then also using AI and machine learning to become proactive in how we approach public health instead of continuing the reactive approach that has been traditionally used in public health. So public health agencies can leverage the recent investments due to COVID-19 that have helped develop strong foundational capabilities that are in place in many areas. And those are, though they are currently limited to COVID-19 support, but it's very important to leverage that. So to answer your question and to work, towards maturing overall processes, workforce, and technology, public health agencies will need to be deliberate about making platform investments through the lens of future resiliency. It should enable proactive interventions through interoperability. It should enable better communication and availability of customized information through self-service. They should leverage intelligent automation for fast and effective data collection, enable consistent advanced informatics to support business intelligence and analytics. And all of this will have to be underpinned, obviously, through policy changes that are needed for new ways of data sharing, as well as framework for effectively managing access to data through security and privacy controls, because we're dealing with sensitive data in many of these cases. So, and then finally, we can't forget about the business processes and workforce, which will be key pillars to success in addition to technology transformation. So utilizing modern technology effectively also requires agencies to ensure modernizing their processes through proper change management, and also modernizing and acquiring and upskilling their workforce for the future.
Certainly what I'm hearing is there were a lot of lessons learned on a lot of dimensions, and clearly if there is a silver lining, and I think there is in the pandemic, it's how much was exposed that can be addressed, and to see how quickly, in many cases, public health agencies were able to address many of these concerns. And it certainly looks like there's a tremendous opportunity moving forward to build on those. So, well, Belinda and Zakir, thank you so much for joining us today to talk about how digital transformation is really helping to deliver greater public health services. Thanks for joining us.
Thank
Thank
you
you.
for having us.